morning and thank you for joining us here on All Things Heart. I'm Alexis Del Cid. We are working hard on the upcoming season of All Things Heart to bring you some incredible, exciting programs in the coming weeks and months. This morning, we have an encore presentation of one of our favorite episodes for you. So sit back and enjoy this best of All Things Heart.
I was on a minesweeper, and then on the last 2 years, I was on a nuclear sub repair ship.
From enemy attack to a near heart attack, on today's All Things Heart, meet the Vietnam veteran and the doctor who saved him decades later.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, October 27th. I'm Alexis Del Cid. Welcome back to All Things Heart. Here's what we're talking about today. Decades after returning home, a Vietnam veteran faced a different kind of danger, this one inside his body. We'll show you the heart problem that led him right here to the University of Kansas Health System for a life-saving surgery. And we get to know the very doctor here who saved his life and who he lives for every day. We're taking you behind the mask. We love that part of the show. And of course, we're ready for your questions. We love it when you send us your questions. Be sure to send them to us on YouTube, Facebook, and the All Things Heart email. You can find the links right there on your screen. Congestive heart failure, as dramatic as it sounds and is, was not something that Gary Rinehart noticed right away. The Vietnam veteran had dealt with so many dramatic events and health challenges by simply pushing through it. But ultimately, that was not how he was going to get through this one. And it would turn out the only team that could provide his life-saving surgery on time was right here at the health system.
Whether it's playing bass with his buddies during their bluegrass jam sessions,
when he retired, he picked up listening to bluegrass,
cruising with his wife Betty,
We did a world cruise.
or simply spending time with his grandkids, Gary Rinehart likes to stay busy. And even though the years this Navy veteran served in Vietnam were just a handful in a long life,
I was on a minesweeper, and then on the last 2 years, I was on a nuclear sub repair ship.
one of the things that came with Gary's service was something insidious and invisible. It would follow him home, contributing to the Topeka man's health problems for the rest of his life, including, he says, his congestive heart failure.
The Air Force was conducting their spray missions of Agent Orange. Our ship was there patrolling when they were spraying overhead.
It's what led Gary here to the University of Kansas Health System for triple bypass surgery. Here's Gary on the operating table with his chest open as his medical team works to give him his life back.
Staff here has been great. They are all angels. I don't want to be treated extra special, but everyone who works here is extra special.
The Topeka man noticed a few years ago it was getting tougher for him to enjoy his morning walk without a tightness and a pain in his chest. It got so bad he could barely climb the stairs in his house. Finally, doctors at the VA in Topeka told him he needed triple bypass surgery.
Normally, the VA would have sent me to Columbia VA Medical Center to do the procedure, but they couldn't get me in soon enough.
The University of Kansas Health System could.
Wow. And thank goodness for that. Gary joins us virtually today. His doctor, cardiovascular and thoracic surgeon, Dr. Omar Almograbi, is here in the studio. Thank you so much for being here.
Absolutely.
Gary, you look fantastic. We got to have an update from you. How are you feeling this morning?
Feeling good. Good to see both of you.
Can you update us on something very important we want to know? How soon after your surgery could you play bluegrass again?
You probably shouldn't know that.
Oh, did you do it right away?
Within 2 weeks, yeah.
Does that go against doctor's orders?
Kind of.
Let me qualify that. I didn't do any lifting. All I had to do was hold my hand like this.
Okay.
Very good.
Okay. I mean, Gary's the kind of guy you really can't keep down.
That's right.
Gary's going to do what Gary's going to do. Dr. Al-Moghrabi, I want to ask you, Gary talked about how they couldn't get him in right away, so he was sent here. You could. What would have happened to Gary if he hadn't been able to find the team here?
Right. Well, first of all, thank you for having me here today. And definitely the introductory video was amazing. And I certainly want to thank you for your service. You know, coronary artery disease is very common. And it's a progressive disease. And we knew that you were having symptoms, and he wasn't able to enjoy some of the activities that he usually, on a routinely, you know, on a daily basis that he does. So it kind of got to the point where he was, you know, you were saying he would walk a few steps and he would get short of breath and such. So those are all warning signs. The heart is not happy. The muscle of the heart is not getting the amount of blood that it needs. So it's giving him symptoms, giving him anginal symptoms, chest pain, shortness of breath, possibly lightheadedness and such. So we knew that time was ticking, and we knew that we needed to operate sooner than later. And I'm glad that we were able to find him a spot as soon as possible.
This isn't something that he could have waited out.
No, typically, once I saw his images and talked to him and listened to his story, I knew that we needed to operate within a month or so, maximum. And I think we were able to get it done within a few weeks after meeting each other.
I want to show some of those images because we have some really interesting things to look at. And I'm glad that there are some red arrows here and some things that you circled, because just as a regular person looking at these images, I would not know what to look for. So what did you see here that was so alarming?
So this is just a chest x-ray actually of him after surgery. And this is just routine chest x-ray looking at some of the sternal wires and looking at the chest.
So these are post-surgery?
Post-surgery, yeah.
And then you also sent us ones where you circled things. So
exactly.
What's that?
So what we're looking at is an image from a left heart catheterization, which is a procedure performed by interventional cardiology. They place a flexible catheter under x-ray guidance into the tip of it into the heart, and then they shoot contrast, and that basically will give us the visualization, the visual of the coronary arteries, and then we can see the contrast traveling to the coronary arteries, and it tells us if there are any blockages or narrowing of the vessels. In the black circle over there, that's the showing narrowing within the LAD vessel, which is the widowmaker. And then
the widowmaker.
The widowmaker.
That's what it sounds like?
What it sounds like, exactly.
That's the most dangerous place then to have?
That is. And that was one of the reasons why we needed to operate sooner than later. And then the other black circle on the previous picture was showing the other branch that was also the red circle that's showing blockage also in another major artery called the circumflex. And you can see the red arrow at the bottom of the image.
Yeah.
That's actually the other side of the heart, the other vessel called the right coronary artery, is getting supply from the left side of the heart. So what that tells me is the right side of the heart is not getting any blood supply because it's completely blocked. And the next image will show you where the contrast comes to a complete stop because of the blockage in that right side of the heart.
So when you don't see any more dye or dark.
Exactly.
Dark going.
Exactly.
Wow, and that would explain why he could barely talk when we first interviewed him, when Alex was in there before his surgery and talking to him. This was a triple bypass surgery. In layman's terms, what's happening? What are you doing to bypass that blockage?
Very good question. So coronary artery bypass grafting or open heart surgery is a very, very common surgery worldwide. It's one of the most common surgeries performed. And the idea of it is to supply blood to beyond a blockage. The heart has two major vessels, the left coronary artery and the right coronary artery. The left coronary artery, like I mentioned earlier, divides into the LAD, the widowmaker, and the left circumflex. And the right coronary artery comes around the right side and also further divides into several branches. Coronary artery bypass surgery is literally taking a healthy blood vessel from another part of the body, whether it's a vein or an artery.
Like from your arm or leg?
Exactly. So it could be from the leg, from the chest, from the arm. And we use it as a conduit to bypass the blockage on the coronary artery. So we usually hook it up beyond the blockage, and then the other end is either connected to the aorta or remains attached to an arterial source to supply blood to that affected part of the muscle.
Does it instantly start working? It's amazing to me that you can take something out of Gary's arm or leg and attach it to his heart, and it works just as if it's part of the heart?
Absolutely. Absolutely. So we see the difference right away.
I want to ask Gary, when we talked to you before your surgery, it was hard for you to get your voice to even work. You couldn't walk up the stairs. You were in a lot of pain. So what does it feel like now just when you wake up in the morning?
It feels very good. Tomorrow I finish up my cardio rehab program. We're doing 20 minutes on the treadmill and 20 minutes on a recumbent exercise bike, and then some upper body strengthening exercises as well. During those exercise periods, I have no issues with feeling stressed. I climb the stairs at home now without issue, so it's all good.
Is Betty watching you like a hawk? I would be so nervous just as a spouse watching you get back on that bike or go jogging or pick up your bass.
She, during the period where I had restrictions as far as weight limitations and that sort of thing, you've seen what that big upright base is. Well,
right.
Bless her heart, she was toting that thing around, and my friends were helping as well.
Oh, you put her to work.
Yeah, she's been helping quite a bit.
We have so many great images to keep sharing with our viewers as we track Gary's progress. And when we talk about and show what his chest looked like after surgery, can you explain again what you see when you look at the after pictures that looks so good? Again, from the naked eye, without a medical background, I wouldn't know, but you have such a trained eye for this. So.
Yeah, we spend the majority of our life kind of training for this moment, and what you're seeing again is just a post-operative chest x-ray. So this is after surgery. We're looking at the lungs. We're making sure the lungs are completely insufflated, and there's no pocket of fluid, pocket of air that needs to be evacuated. Also, we're looking at the sternal wires. So we use stainless steel wires to close the sternum.
Okay.
And in his case, I used 8 different wires to close his sternum. So usually when we get a chest x-ray, we evaluate the sternal wires to make sure that they're still intact and everything else looks okay.
Now, when we talk about recovery, we know Gary's recovery was on Gary's timeline. He was, without your knowledge, playing bass. What's a typical recovery like?
Good question. So it depends on the patient, it depends on their functional status, depends on their nutritional status, comorbidities. But in general, most people spend about 5 to 7 days in the hospital after surgery. Once they go home, we expect them to walk at least 30 minutes per day, expect him or them to not lift more than 10 pounds for a total of 8 weeks to protect that sternum. Most people are back to driving after 2 weeks. Some people are back to work sooner than 8 weeks. Total recovery, full recovery could take up to 2 to 3 months in most cases.
We have some community questions from our
Absolutely.
viewers. So they're coming in. Tommy has a great question. Actually, there were quite a few of us that had this question. So is a triple bypass more dangerous than, say, a double or a single? Does it get more dangerous the more bypasses you do?
No, not at all. So what it means basically, double bypass is how many vessels or how many coronary vessels did we bypass. So double bypass means we perform 2 bypasses. Triple bypass means 3, quadruple 4. It all depends on how many blockages we noticed, and that will dictate how many bypasses we perform.
Marie wants to know, what are the most bypasses you can do on a heart?
I don't think there's a certain number. I can tell you that the most I've done is 6.
6.
The average, however, is about 3 to 5 usually.
Okay.
And we're trying to get the most important vessels like the LED, the Widowmaker, and some of the major ones. And we don't go after every little vessel. We also only address the vessels that are diseased. So if there's a vessel that is not diseased, we usually do not mess with it.
What's the real name of the widowmaker? I mean, in the anatomy books, is it called widowmaker, or what's it called?
No, it's called the LAD.
Okay.
The left anterior descending artery.
The widowmaker. Jim wrote in, and Jim wants to tell you, Gary, thank you for your service.
Absolutely.
And thank you
You're
for
welcome.
your service, Gary.
Thank you.
June wrote in. What's up?
I would interject. My middle daughter requested of the doctor, if I were to have to do this again, she said, if you would take that incision a little lower, at least I would have a 2-pack when you were done.
All right.
Do you take requests?
Sure, absolutely. Anytime.
That's great. June wants to know where, this is for Gary and Dr. Al-Maghrabi, did you take the veins from Gary's arms or legs?
So we typically get a vein from the leg. It's called the greater saphenous vein. It's a superficial vein. So in his case, we used a vein from his leg and then an artery off of the chest wall. Occasionally, we also get an artery off of the arm. And so those are usually the condos that we use.
But you were able to do all 3 bypasses with that one vein and the other artery?
Yes, exactly. So the vein, we basically fashioned it into 2 pieces. And so we used that vein for 2 different bypasses. And then the artery for 1 bypass. So a total of 3.
June's question was a 2-fer, actually. She also wanted to know, Gary, did it feel strange after the surgery? Did your leg feel strange, having the vein taken out of it?
Not at all. I witnessed my father having this very similar operation when he was alive. And so I had the recall of what I experienced with him as far as his recovery period. So I was a little bit apprehensive, on what I was going to experience, but I was amazed that I didn't have hardly any pain at all. It must have been the drugs or something, but very, very minimal discomfort.
Gretchen has a very important question for you, Gary. She wants to know if you play bluegrass for the public and where she can see you play.
We have the public come to locations in Kansas City area. It's called the Heart of America Bluegrass Club, and it's on North Vivian Road. I think it's 1321 Northeast Vivian Road. On Friday nights during the winter season, it's an open thing. The public comes there and listens to us. We have musicians from the area come around, and these some of them are nationally and internationally touring musicians. So if you want bluegrass, you just have to look a little bit, but you can sure find it.
How did you start playing bluegrass?
As a young man, I played electric bass, self-taught, play by ear. I don't read music at all, and that's true of most bluegrass musicians. When I got out of the Navy, got married, started raising a family, and didn't have time or interest in playing rock and roll anymore. And my dad was country music. He enjoyed country music as a rhythm guitar and singer. He wanted me to play country music, but my interest wasn't there. But about 55, shortly before I retired, I heard bluegrass music for the first time, which is kind of similar to country music. And I thought, wow, I like the sound of that, but I had never messed with a double or upright bass at that point. Went to a bluegrass jam, nuzzled up next to the bass player and told him, yeah, I used to play bass. And he said, well, here, and handed me the big bass. And I said, know nothing about it. And he said, well, it's the same as this. It's just like this.
Right.
So
that's awesome.
All of the recall was up here. It just took some muscle memory practice to come up to speed. And it's been a blessing in retirement. We've made friends, and I was fortunate to be able to play a bluegrass festival in Wales a few years back.
In Wales, the country Wales?
Yes.
Okay.
One of the guys you saw in the video clip there, he and I went. We were supposed to travel as a band, but there was some health issues with another member that come up that prevented the band from going. But he and I went with our wives, and we were gone for close to a month and played that festival in Wales and met some really nice folks.
I never would have thought the Welsh were into bluegrass.
I would
but
not.
You learn something new every day. You learn a lot of new things working here
It
at
is
the health
worldwide.
system. I want to ask Dr. Al-Maghrabi a quick question that I had when Gary talks about he saw his dad have this same surgery. Bypass surgery has been around for a long time. How has it evolved? You know, were there new tricks that you could do on Gary that you couldn't have done on Gary's dad?
You know, the surgery has been around since, you know, the 60s, and it really, the conduct of surgery hasn't changed much, except for example, the vein harvesting from the leg. We do it endoscopically now, meaning small incision, and we use a camera with a scope, and we can pretty much tunnel underneath the skin and get the vein with that old school fashioned way of doing things where we big incisions. And so the recovery from that standpoint is a lot easier on patients. But really the rest of it, as far as opening up the chest and doing the bypasses and being on the heart-lung bypass machine, that has been pretty much the same. And this tells you about how good the surgery is. It just has a very good track record. It's been around since, you know, like I said, the 60s, and really not a lot has changed.
Which something that sounds so alarming to a regular person without a medical background or when you're a patient is something that you do every day. That's just something that's so incredibly safe, is what you're saying.
Absolutely. I mean, it does come with major risks and possible complications, but that's why we try to optimize and minimize all of our risks as much as possible.
Well, Gary's living, breathing, walking proof of how well this surgery goes. And I want to bring in Gary again as we get to our final thoughts. And Gary, I want to start with you because when we first met you after your surgery, you and your wife, Betty, you were so grateful for Dr. Al-Maghrabi. I believe it was you or Betty that called him an angel. What made the biggest impression on you both when it came to having that feeling coming away from this?
It was the entire team, the nursing staff there. I'm sure I was under heavy sedation during parts of it, but I still have an image of Nurse Catherine in my head, having to wear the mask because of the COVID considerations, but just the eyes and the caring that was exhibited throughout. And doctor, before the surgery, had such a calming manner, just totally grateful. Thank you.
It's pretty nice in here.
Absolutely.
You ready for more? Because I have more. I want to share a message from Gary's wife, Betty, because Betty had something to say to you, Dr. Al-Maghrabi.
I would say thank you for everything. We have so much to do. We're not ready to stop. This is going to make it all possible. Breaks my heart that he had to go through that, but I'm looking forward to the future.
I mean, you gave them a future together, and that's all anyone could dream of.
Well, thank you for the message, and you know, no greater privilege than operating on someone's heart, and it brings me so much joy to hear her side of you and his side of you, and I appreciate that. Thank you very much.
I actually just got 2 questions from viewers, and I want to get these in because these are some viewers that wanted me to ask you. Angela Saylor had a question. She said she had arteries taken from her left chest and right leg. She's having some numbness. Will the numbness go away eventually?
We're assuming we're talking about numbness in the leg. Typically, yes.
Okay.
Typically, yes, because when we do this type of harvesting, it's very superficial. So the major nerves and nerve supply to the leg is not even close by. So some of the superficial nerves to the skin can get in the way and can get a little bit, stretched out. Nerves take a long time to recover. So typically, yes, the numbness will eventually resolve.
Kim Moore Bosley has a question. She wants to know if heart disease is passed down from your parents because her dad passed away at 55 from a heart attack.
So coronary artery disease is very prevalent. It's very, very common, and there are some risk factors that are modifiable and some that are not modifiable. So the ones that you can't really control is your genetics, which can attribute about up to 60% of coronary artery disease. So you can't really choose your parents, unfortunately. The next thing is aging. As you age, you're more likely to develop coronary artery disease. So those are the things that you can't really run away from. The things that can help or improve your chances of not developing coronary artery disease is to make sure that you exercise, eat healthy, don't gain weight, don't smoke. If you have diabetes, make sure it's controlled. If you have hypertension, make sure it's controlled. Same thing with cholesterol. So those are the things that you can help yourself with.
I want to wrap up this part of the conversation. We still have to get to your behind the mask.
Okay.
But is there anything that you'd like to say to Gary? You know, Gary has been the model patient as far as positivity, and nothing gets this guy down. So what's it like when two forces like you and him come together?
It's amazing. You know, I met Gary before surgery, and then I met him after surgery, and then a few weeks later he came in for his first follow-up visit, and he looked good then. But it's rare that we get the chance to see how they're doing 6 months later or many months later, and this is amazing to see that what you're doing out there and how you're feeling, and to know that you're doing a lot better and moving along just fine. So I'm very happy for you, and it's very rewarding, for sure.
Well, thank you. Because of you, I was able to meet my 10th great-grandchild, at a bluegrass event and feed that baby. Betty and I will be headed south here in about a week for our annual Sojourn to South Texas, where we'll be playing music all winter long with friends. And then when we get back from that, we've got a month-long cruise booked out of Barcelona along the Italian coastline. So life is good, and thank you for giving me that opportunity.
Oh,
absolutely,
man.
absolutely.
That's incredible.
That's amazing.
Well, we love having our doctors on the show because not only do we get to know our patients, we let you guys get to know our doctors and what makes them tick. So it's time to go behind the mask with Dr. Al-Maghrabi. He and his wife have a 3-year-old boy. What's your 3-year-old boy's name? Because we have a picture.
Amar.
Okay, Amar. And here you guys are at Disney World. But you know what? It looks like you're going to have to make another trip so someone else in the family doesn't get jealous looking at the albums. Who's that in your arms with Amar?
So that is our daughter, Elena. She is 6 months old now.
Yeah, how busy did they keep you?
Very busy. I honestly don't have any hobbies anymore. It's just all dedicated towards them. And Amar is finally, you know, he's 3 years old, so finally we can actually go outside and do stuff together.
Like, we have another picture. Like riding bikes.
Riding bikes. So I'm finally getting some of my hobbies back. We go out quite often, you know, around the city, or maybe like neighborhood, few blocks. Very intense.
Very intense. Is he still has his training wheels, or is he on two wheels?
Yes, he is, but it's just trying to keep him on track on the sidewalk.
That's stressful.
Very intense, yeah.
That's a stressful process.
Yeah.
Full disclosure, when we saw the picture you sent us, we all collectively melted in here. You have the cutest family.
Thank you.
Precious. Thank you so much for making time to be with us today. We know how busy you are. We appreciate it. And a huge thank you to Gary for sharing your journey with us. Can't wait to see you play bluegrass again. We got to get a group together and go see one of your performances. Thank you. And thanks for watching us.